The urinary bladder is an important organ of the urinary system that is responsible for storing urine. Structurally, when the bladder is empty, it has a pyramid shape, but as urine accumulates, it becomes ovoid in shape. This reflects its nature as a highly stretchable muscular organ that can expand like a balloon. The urinary bladder is located in the pelvic region, behind the pubic symphysis, which is the joint between the left and right pelvic bones. When viewed in a sagittal side section, its anatomical relationships become clear. In males, the rectum lies posterior to the bladder, whereas in females, the uterus is located behind the bladder, with the rectum situated behind the uterus. Anatomically, the urinary bladder is divided into 4 parts: the apex, neck, fundus, and body. The apex is the upper anterior part that faces the abdominal wall. The neck is the inferior portion from which the urethra begins. The fundus, also known as the base, is located posteriorly and inferiorly, representing the region behind and below the bladder. The remaining central portion is referred to as the body. Inside the bladder, there are 2 openings called ureteric orifices, through which urine enters from the ureters. Between these 2 openings and the opening of the urethra lies a triangular region known as the trigone, the urinary bladder. The bladder wall contains smooth muscle fibers called the detrusor muscle, which provide the organ with its stretchability and ability to store urine. The urinary bladder typically holds about 400 to 600 milliliters of urine. As the bladder fills, stretch receptors in its wall send signals to the nervous system, creating the urge to urinate. During urination, the detrusor muscle contracts to expel urine from the bladder. At the same time, the urethral sphincter muscles regulate the flow by relaxing and contracting as needed. These sphincters normally remain contracted to maintain continence and relax when urination is initiated, allowing urine to pass through the urethra and be excreted from the body.